The cross-cultural negotiation framework offers health professionals a pathway to negotiate across different systems of understanding health and illness and work toward a mutually agreed plan with the patient. The aim of this process is not to convince the patient of what you say or to establish a right or wrong approach. Instead, it is about showing the patient what you know, to understand their belief system, and to illustrate the benefits they will gain from the plan of action that is advocated. The 5 steps are: step number 1, explore the patient's perspective. Patients are not spontaneously going to tell you about their health belief system and how they view their illness. So, to explore this, you can use Kleinman's explanatory model that is covered in Chapter 4. Step number 2, explain your perspective. By doing this, after allowing the patient to relay their perspective, you have already given them a chance to show you what they find is most concerning to them about their illness. Using appropriate language and again ensuring that you do not assert a wrong or right approach is very important. Step number 3. After you have explained your perspective, then you need to acknowledge any differences in opinion that exist between the different health systems. This, again, should be done in a respectful way that acknowledges the patient's health belief system. Step 4 is to create common ground from the similarities between your health beliefs and perspectives and those of the patient. And then finally, step 5 is to settle on a mutually acceptable plan, one that takes both patient and practitioner's views into account and provides the patient with relevant, understandable care where they have been part of the decision-making process. Cross-cultural care is an ongoing process of discovering and negotiating the differences that are relevant to the patient. In a health context, cultural difference cannot be solved by arguing that the physician's perspective is right and the patient's perspective is wrong. These are values and perspectives, not black and white facts, and generally people feel very strongly about their personal values.